What's up, y'all? What's up, y'all? What's up, y'all? What's up, y'all? So a little bird flew past my window singing a song about this newly approved weight loss drug, Wegovy. Wegovy? Wegovy? You know what? I'm gonna solve this right now. Wegovy. All right. Yo, check it. There's a YouTube video.
Wegovy.
What? All right. Well, this dude does appear to be an expert on pronouncing different words.
Ice Cube.
But I'm gonna go with Google on this one. So this drug has been in the news recently and it's being touted by some publications as a game changer for weight loss. I'm gonna be honest, I was gonna talk about something completely different this week, but since I literally just made a video about how there are no easy solutions for weight loss, I figure I should take a look and see whether the game has really changed or are we still in early access. Alright, so what do we know about this drug and why do people think it's a game changer? Wegovy is the brand name they've given to a drug called semiglutide, which has actually been used medically in the United States for about 3 years now. It's a synthetic version of a hormone that naturally occurs in the body called GLP-1 or glucagon-like peptide 1 that gets released by the small intestine shortly after eating a meal. Like most hormones, it plays a few different roles in the body, but the one that has all the pharmaceutical executives changing their underwear is its ability to promote insulin secretion. Insulin, for those who may not know, is another hormone that the body produces to help regulate blood sugar. And chronically high blood sugar can cause a range of serious health issues. People who are diabetic have an impairment in their body's ability to produce or respond to insulin, and that's part of the reason why semaglutide is already being prescribed for type 2 diabetic patients under the brand name Ozempic. Ozempic was researched and developed by a Danish pharmaceutical company called Novo Nordisk. They've been in the game for a minute and diabetes is kind of their thing. They're behind a range of synthetic and semi-synthetic insulin-based drugs you may have heard of, like Levemir, Novolin, Novolog, and Victoza, among others. They've even made their own special kind of pen needles called Novafine that are supposed to cause less pain, be easier to use, and reduce accidental injury. Now, Victoza is the brand name for one of their other anti-diabetic drugs called liraglutide. Semaglutide, or Ozempic, and soon to be Wegovy, was developed as a longer-acting alternative to liraglutide. After several clinical trials, it was demonstrated that semaglutide causes a greater reduction of A1C or blood sugar levels in type 2 diabetic patients compared to other available drugs on the market like Trulicity, Lantus, and basal insulin with or without metformin. Alright, but how is semaglutide gonna help me go from badonkadonk to just badonk? Well, it looks like they kept running clinical trials. See, Ozempic, the form of semaglutide that's already in use, is prescribed at a dose of 1/2 to 1 milligram per week. You actually start at 1/4 milligram for 4 weeks, and then after that you move up to 1/2 and then up to a maximum of 1 milligram. Wegovy, once it reaches your local pharmacy, starts out with that same progression, but instead of stopping at 1 milligram, they increase the dosage up to 2.4 milligrams over a period of at least 17 weeks. Now you might be wondering why they don't just give you the full 2.4 milligrams from the start, and the reason is because you will die instantly. Nah, I'm just kidding. The reason they provide in the statements they've been putting out is to reduce gastrointestinal side effects, which prompts me to ask, what gastrointestinal side effects? Because it might not be worth losing the weight if I'm gonna end up shitting my pants every week. Well, if we look at the data from the clinical trials, they provide a nice little table that lists all the side effects that at least 2% of the participants experienced over placebo. You can see here that 44% of the patients given semaglutide were nauseous, about 1/3 of them had diarrhea, and about 1/4 of them were throwing up. Other side effects with similar or less frequency were constipation, abdominal pain, headache, fatigue, dyspepsia, which is basically indigestion, and amusingly lower down we have eructation and flatulence, which you should all fondly recognize as and. Also, I couldn't help but notice down at the bottom it says that 1% of the people in the placebo group experienced hair loss, and if N is the sample size, at least I think it's a sample size, then 1% of 1,261 means that about 12 or 13 people thought they were losing their hair due to the drug they were taking, when in fact the truth was, nah bro, you just going bald. Welcome to the club. Speaking of side effects, there are some risks associated with taking the drug. They don't want any pregnant people taking it, which is fairly par for the course, especially with newer drugs, but if we look at the prescribing information under warnings and precautions, they list acute pancreatitis and acute gallbladder disease as potential risks, and in both cases they indicate that these conditions have occurred in clinical trials. If we look into it a little further, they state that 4 people experienced acute pancreatitis during the clinical trial, with 1 additional case being confirmed during another trial. As for the gallbladder, 1.6% of the patients experience
cholelithiasis,
while 0.6% of the patients experience
cholecystitis.
So basically, if you have a history of trouble with either the pancreas or the gallbladder, you should definitely talk to your doctor about whether or not this medication is right for you. There were also some patients who experienced acute kidney injury, retinal disorders, and low blood sugar, but those are a little more iffy because those conditions are already associated with diabetic patients, and I guess their data doesn't necessarily indicate that these conditions were caused directly by semiglutide. Nonetheless, some people did have these things happen to them during treatment with Wegovy.
You know, he can hurt his pancreas or something like that.
You might have also noticed, if you haven't fallen asleep already, that I skipped the first warning on the list. Thyroid C-cell tumors, or cancer. But what the f is up with that, right? Here's what they gotta say. In mice and rats, semaglutide caused a dose-dependent and treatment duration-dependent increase in the incidence of thyroid C-cell tumors, adenomas, and carcinomas after lifetime exposure at clinically relevant plasma exposures. See nonclinical toxicology. Well, I don't know who nonclinical toxicology is, but it better have some f***ing answers. So check it. They did a 2-year carcinogenicity study in mice. Based on their weight, they gave the male mice either 2, 8, or 22 times what the recommended human dose would be, and for the female mice, they gave them 0.6, 2, or 5 times the recommended human dose. In all mice at all dosages, a statistically significant increase in thyroid C-cell tumors was observed, and that includes the mice which were given the 0.6 or just over half the recommended human dose. That said, they basically go on to say that just because it happened in rats and mice doesn't necessarily mean it'll happen in humans. However, it did in fact happen to rats and mice, and they're required to tell you about it. Actually, I'm gonna be honest, I don't really know if they're required to tell you about it, but I will say this. They probably felt like it was in their best interest because in 2017, they paid $58.7 million to the United States Department of Justice to settle multiple whistleblower lawsuits regarding their lack of disclosure to doctors about the cancer risk for their other diabetes drug you might remember from earlier in the video, Victoza. Alright, but if there's so many risks involved, then why are people calling this a game changer? Well, according to this report, greater proportions of patients treated with Wegovy achieved 5, 10, and 15% weight loss than those treated with placebo. Let's check out the table. In the first trial they ran, which was specifically people who are obese or overweight with comorbidities, 47.9% of those on Wegovy lost 15% or more of their total body weight. And 15% might not seem like much, but if you weigh 300 pounds, that's 45 pounds gone, just from taking the drug. The second trial was done with type 2 diabetic patients who were obese or overweight, and the results weren't as stellar, but still, a quarter of the participants lost that same 15%. For the third trial, they focused on patients who were obese or overweight and comorbid, but who were also undergoing intensive lifestyle therapy. In that study, 53.4% were able to lose that 15% of their total body weight. Those numbers are actually kind of crazy, especially when you compare them to their other weight loss drug, Saxenda, for example, which is really just the same drug as Victoza, but in a higher dosage. With that drug, on average, patients lose just 5% of their total body weight. So I'm a big believer in the idea that there are no panaceas. In other words, there's never going to be that one thing that solves all of your problems because the universe just doesn't work that way. Even people who get bariatric surgery, for example. Most people do lose weight, but the ones who manage to lose the weight and keep it off are those who supplement the surgery with lifestyle changes like diet and exercise. So while the media might be trying to clickbait their way onto your prescription drug plan, you would do well to remember that while these results are absolutely promising, there are risks associated with those results, and it's going to take more than just this drug to lose weight and keep it off. If you're not new to my channel, you'll know I've said numerous times that weight loss takes time and effort, and it's probably never going to be as simple as just take this drug for the rest of your life and live skinnily ever after. There's also the idea that drugs ain't cheap, at least not the legal ones, and pharmaceutical companies aren't exactly known for their generosity. There's been no specific discussion of listing price, but that 5% drug that I mentioned earlier, Saxenda, that typically costs around $1,300 a month without insurance. If you've been through the medical system or dealt with medical insurance here in America, then you'll know that they don't like to cover shit. If they can't get away with just straight up telling you that your weight isn't severe or life-threatening enough, they're probably going to make you try a million other drugs before they let you give Wegovy a shot. Not because they care about your health, but because all those other drugs are cheaper, and not cheaper for you necessarily, but cheaper for them. They're not your friends. No insurance company is, and no pharmaceutical company is either for that matter. Interestingly enough, when I was doing research for this topic, I came across this YouTube video from this family practitioner named Dr. Ken Berry, MD. He took the time to take a look at each of the scientists involved in the research for Wegovy. He compiled a nice little list that shows that every single researcher on their team has some kind of interest in the company, whether it be lecture, consulting fees, to even straight up being an employee and owning stock in the company. Now, that doesn't necessarily mean that they're doing anything wrong. What it does mean, however, is that every one of those people stands to benefit in some way if Wegovy does well, not only in their clinical trials, but also on the market, which is something that people should be aware of. All in all, I'm not trying to dissuade anyone from taking this or any other weight loss drug that might pop up. What I am trying to do is make sure that anyone who wants to listen to me or my bullshit can make an informed decision about whether or not a drug like this might be right for them. It's easy to get caught up in the hype, just like it's easy to forget that the future always looks bright when you're staring at the sun. Before you make your moves, make sure you can see what's lurking in the shadows. Carcinogenicity. Alright, so I hope y'all found this useful. Like I said, I was in the middle of writing a different video, but I came across some buzz about this drug and I kind of had to look into it. One of the things they say about content creation is you want to provide value to your audience. So while I feel like my perspective is valuable enough, the more I looked into this drug, the more I felt like there was a lot of information that most people who hear about it aren't going to come across. So I want to thank you for watching, because even if you're not a candidate for this drug, you are a candidate for my heart. You are a candidate for my ass. You are a candidate for liking this video and subscribing to my channel. And you know what? I got to give some love to the people leaving comments. Man, I'll tell you what, if I ever end up making it on this platform, I want you to know you're playing a huge role in that success right now. I made it this far because of you, and if I can manage to make it any higher, I'm taking y'all with me. So keep leaving these comments and I'll make sure that some of your words reach this audience every time mine do. Last but not least, I will be back soon, but until then, take care and take notice.